Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason to come and see me is for back pain with radiation of pain, numbness, or weakness into one or both legs. Symptoms are usually worse the longer you're up and walking or if you're trying to bend and lift. By the time we're talking about surgery, it means that you've already tried physical therapy or chiropractic treatments, maybe even some injections, and they didn't really work. So now you're here to look at the next option, which is surgery. The most critical part of surgery decision making is to see if your symptoms match the MRI findings. If they do, then surgery should be a very good option for you. You will have the highest chance of successful surgery, one in which you will resolve all your symptoms and get back to normal full work function. Most of the time, the diagnosis is pretty straightforward, but sometimes we have to distinguish a lumbar disc problem from a sacroiliac joint problem. In order to do that, sometimes we need to have confirmatory tests such as specific injections and or even discogram. As you can see on this model, the discs sit in the front part of the spine and the nerves, which are in gray, are sitting behind it. There are three ways to approach the spine to do a fusion. One is from the posterior approach, where we remove some bone from back here, called the laminectomy, and actually access the disc going around the nerves. The other approach is from the side, and the third approach is from the front. I prefer not to do the posterior approach because of all the issues going around the nerves. It's probably best to avoid them. That will decrease your risk of any nerve injury. Going from the side or the front, you just have to push the bowel out of the way. If you're working at L5S1, which is the lowest disc here, I usually use a general surgeon because they're also your aorta and the big veins that are down here that need to be pushed out of the way to do the surgery from the front. For the other levels, the blood vessels are sitting in front of the spine, so I can just go directly from the lateral side. Besides having less risk to the nerves, the advantage of going from the side or the front are that you can put a much bigger implant in there. The implants are all hollow, so that gives you a much bigger surface area for fusion. We fill that hollow area with crushed bone and other material that makes you make bone faster. We can also put plates directly into the bones to hold them together very tight. So a typical way of doing a lumbar fusion down to the L4-5 level or all the way up to into the chest area is that we make an incision right over the disc. We have to push the bowel a little bit out of the way, and we have special instruments, including tubes that we put down so we can work right through a tube to get to the area that we want. We do a complete discectomy from side to side. And then we have an implant that I am going to try to show you. You can see the edge of it here underneath the screw and plate. And that gets filled with material that's going to help you make bone, and we put that in place. That will hold these two bones in the right location and with the material needed to form a fusion. We prefer to put screws and plates on the side. That's like an internal cast so that your bones have a higher chance of fusing. So what are the risks of surgery? There is risk of bleeding and infection, just like any other surgery. The other risks are all related to working on and around the nerves. Those include weakness or paralysis, numbness, loss of bowel and bladder function, and that surgery may not resolve all your symptoms. The chances are low, but never zero. Depending on the complexity of your lumbar fusion, you would typically go home a day or two later. Sometimes you may be able to go home later that same day. I would like you to keep the dressing dry for the next 2 days. Then you can remove it and take a full body shower. However, stay out of soaking in water for a prolonged period of time, such as in a bathtub or in a pool. I would like you to keep lifting less than 10 pounds You can walk and go up and down the stairs as needed. I will see you back in the office in 2, 6, and 12 weeks typically. There will be x-rays involved to see how your fusion is coming along. You will typically go back to light duty work at about 6 weeks and heavier work at about 3 months.